Hi, my name is Kim Smulderen from the Mid-America Heart Institute, and today we have Tracy Wang and Adrian Hernandez from Duke discussing the role of social media in the quality of care. And I'm going to start off with this question. How do we use social media in the organization of our care, and does that lead to a better care that we can provide to patients?
I guess the first part in terms of do we use social media and other means for understanding or searching health is done all the time. Whether it leads to better care, I don't know if we actually know the answer to that. If you start thinking about what's the potential there, where, say, for instance, people are flagging new symptoms, that it may be easier for them to identify what problems they may have. And so you could imagine earlier diagnosis. So, for instance, could you have earlier diagnosis of, say, coronary disease, or earlier diagnosis of heart failure, atrial fibrillation, that would lead people to actually start searching for answers to those symptoms, and then actually reaching out to other clinicians about what to do next. So, possible.
So from a provider standpoint, but also from a patient standpoint, do we still feel overwhelmed as to how we can integrate it? Because you gave a few good suggestions, but how can we structure all this and give some tips to people if they want to navigate the internet to find information on their health?
Well, that's interesting. So, because right now they're almost, really two parallel systems. So, what people have access in terms of their healthcare system, and then what they have access in terms of the global internet. Often we feel that what we're providing via the healthcare system is more valid, that actually it's more trustworthy, but often it's impenetrable. Like, how do you actually get it easily identified for people? And so that's why people are often searching elsewhere to look. And then I think the second thing is also considering, is there information that actually could come in from, say, our patients who are searching about their symptoms, and actually getting that fed back into the healthcare system, so that when they come in, we actually know what we should be talking about, because they've been talking out in their social community about their issues.
So I hear you saying we can do a better job in giving high quality information and providing easier access to patients so that they can find and better prepare themselves as they visit their physicians.
Absolutely. So, one concept that's being developed by some of the big search companies is actually knowledge panels. And so how can actually healthcare systems also do the same thing and do it in a uniform, easy way, and or support those efforts for knowledge panels that people are search and then can find.
Now let me ask Tracy, do we feel as researchers overwhelmed by social media, or is that leading to greater engagement? How do you feel about that?
I honestly don't think that we're overwhelmed in any way, shape, or form. I think we're all starting to learn about social media a lot more. It really has changed how we interact with each other, and by we I mean both physicians as well as patients. So you have our old model of disseminating new research has been publications and presentations at scientific sessions, and we're seeing that more of this is now being done through social media such as Twitter or Facebook. We're also finding out patients aren't as alone anymore, so they can certainly get on the web and ask Dr. Google, but they also go on their social media to try to find other patients who are like them, and can sometimes make medical decisions based on that. And I think we're at a time where I think we're all still kind of exploring how social media can really ultimately improve health. So I think overwhelmed is probably maybe not yet. But this is certainly an exciting time for us to think about how we can really leverage the power of social media and the reach of social media to try to improve health.
And how do you think we can reach people who have not been that engaged with social media, or are a little bit more skeptic about the use of social media to disseminate knowledge, but also to get health information? How can we engage them?
Well, we actually probably don't have a whole lot of work to do there because more than 2/3 of patients are already on social media. It doesn't matter how old or how young they are. It doesn't matter what kind of socioeconomic status they are. So, many of the disparities that we often recognize in clinical practice are much less evident on the social media, in the social media space. And I think the general sense is that people are looking for ways to connect with each other there, and so we need to really focus on the value proposition for the folks that are engaged in social media. So, for example, if we as clinicians are thinking about engaging patients in healthy behaviors, this can be achievable with social media beyond the setting of a hospital or a clinic, but we need to figure out how to do this and do this well. Or as we think about it from a research standpoint, I mean, social media will actually open up totally new data streams for us as we think about how, the different dimensions of healthcare here. And we may choose to intervene based on those dimensions and disseminate those interventions through social media. Or we may leverage social media as essentially a doorway for the patients to really start interacting with us as researchers and clinicians, and really get into the nitty-gritty of changing healthcare through research.
So in social media, oftentimes there's opinion leaders and people with louder voices have more traction. So how are we going to make sure that the information that is being spread is not led by emotions or certain opinion leaders and not others? So how do we filter all this?
That's a fantastic question. First of all, I think we need to establish that anything disseminated by any of the three of us, we should just take to be true. But actually in the social media space, often it's the numbers game. So whoever has the most followers or, the loudest voice often tends to be the most visible. And I think we still need to make sure that the concept of evidence-based medicine is still in practice, as opposed to emotion-based medicine, as was recently written in an article. So making sure we've got the proper E there. And this is where a lot of work really needs to be done to make sure that social media is helpful, not harmful.
And along those lines, I think one of the worries that's outside of healthcare is that if you look at the evidence about, say, fake news, the rumors, those actually speed much more across social media than, say, the real news, because they're outlandish, they're get a lot of attention. And so one worry about healthcare is, are there equivalents? It's probably an unknown yet, but that's a real worry.
So that brings me to the topic of protection, and you already mentioned, Tracy, we are going to gather a lot of new types of data from this. So do we need to think about how we are going to protect patients and data, people that provide data? How are we going to make sure that data integrity is maintained in this platform as well? You have any ideas how we need to come together to organize this?
Well, I guess, one thing that comes up is that, if there are platforms where it's actually asking permission or a contract with patients to share information and do it in a trustworthy way, that's probably the best thing. So doing it proactively. And then also reporting out, annually, how information is being used. And then having a process that helps people understand that there is always an attention and policy towards security and privacy. And as part of that, there may be some risk, but if there's something that is identified, being very quick and transparent about it so that trust is still maintained.
Tracy, do you have any additional?
I would say I totally agree with Adrian's comment. I think we need to be very proactive about this. And I think one of the key ways to be proactive is to make sure that we have an effective partnership with our patients, our research participants. It's not a unilateral decision. We can't afford to be paternalistic and assume we know what patients want. I think patients need to have a very, very active voice in terms of determining what's necessary here. And the proactive part is important because we tend to live in a society where we're reactive. So we're reacting to, scandals that are out there that are being reported about data security and data breaches. And but when that's happening, we're really not. We're really distorting the message. The message now isn't about science. It's not about improving care. It's about some of the things that perhaps are rare, or maybe sometimes not so rare, but safeguards can be made proactively about them.
So if I may summarize, I hear that you both are pretty enthusiastic about the use of social media, both in the way we disseminate our knowledge, also come together to discuss with each other and reach patients in a different way. It has the potential to be more inclusive, but I hear you both say we need to be very proactive in making sure that we keep our standards on data integrity high. Well, thank you very much for your contributions.
Thanks.